So in the United States, about 1 in every 3 births is via cesarean section. So chances are either you or somebody that you know very well delivered this way. And in our current model, women are educated on early scab and scar formation in order to avoid that infection. But because of the dense irregular network of a scar, just how deep it goes, much deeper than what we see at the superficial scar, and then the necessity to cut through superficial nerves in order to reach the uterus, there are some issues that can occur later on down the road. Issues like altered nerve sensation, nerve irritation, a pulling or a tugging sensation, which can affect pelvic or core function, an altered connection to our abdominal muscles, which can affect back pain or hip pain. So in order to avoid those issues, I'm going to show you how to mobilize your own scar. Now, it is great if this can be done right after that 6 weeks of acute healing, but even if that's not possible and you're much further away from your own C-section, it can still be very, very beneficial.
So this is obviously not a C-section incision, instead an old emergency appendectomy scar, but the principles still apply. So we are going to do multi-directional, somewhat deep, so that you're going beyond just the top layer of skin, circles, and you'll go clockwise and counterclockwise around here, and then you'll go back and forth. So the key is to realign these collagen fiber bundles and get them moving multi-directionally. And then the last thing you'll do is some skin rolling, where you are going to actually pick up the top layers of skin. You can feel for areas where there's adhesions and spend a little bit more time there. This is obviously going to be done once you have had beyond your 6-week check-in with your OB and you know that your scar is in good shape and healing well.
So it is great if this sort of treatment can be supervised by a skilled physical therapist, but I recognize that's not possible for everybody right now, and there is still so much that you can do on your own. But if you have any of those issues that I mentioned earlier, or this brings up any other questions with your postpartum care, then feel free to reach out to me and we can figure out an individualized program for you.